Good evening and thanks for joining us. It's the kind of news no health official wants to announce. Bird flu has hit North America. The first confirmed case has killed a person in Alberta. It's important to note this is not the same as the seasonal flu many of us have been vaccinated against. This is H5N1 Avian flu, the one that caused a number of deaths in Asia. Health officials say this is an isolated case and the risk of it spreading is extremely low. Mike Couteur has been speaking to the authorities about it and joins me now. Mike?
Well, Donna, those same authorities are releasing very few details about the victim, only saying that they're from Alberta and that they contracted the disease while they were over in Beijing, China. And they're saying that person did not visit any farms or any markets, so it's believed that they did contract it while in the city. On the other side, though, they are giving very detailed information about how this person came back to Canada, saying that on December 27th, they took a flight from Beijing to Vancouver, Air Canada flight 030. They spent a few hours at the airport, then took flight 244, also on Air Canada, to Edmonton. This person was admitted to hospital on January 1st, and their condition deteriorated so quickly that the person died on January 3rd. Now, they are emphasizing here that human-to-human transmission is extremely rare. That is why they're saying there's really no reason to worry and no reason to actually have a ban on travel to Beijing.
This is the first and only confirmed case of H5N1 in North America. The risk of transmission is very low. There is no evidence of sustained human-to-human transmission.
They're also stressing that the symptoms for H5N1 are very different from the seasonal flu. In this case, the patient presented themselves at the hospital with a fever, headache, and malaise. Now, seasonal flu has those types of symptoms, but also there is the cough and sore throat, which is normally associated with the seasonal flu, and officials are saying, again, these are not the same types of symptoms. Donna?
And Mike, tell us about the rest of the passengers on those two Air Canada flights. What are they being advised to do?
Well, that's exactly why they are releasing the flight numbers at this point. Health Canada officials will be contacting every person who is on one of those flights and reassuring them that there's no reason to worry. Even though they may have been in contact with this person, the human-to-human transmission of avian flu, or H5N1, is extremely low. They are even taking further precaution for the people who treated this person at the hospital and the family members of this victim. They are not presenting symptoms at this point, but health officials have already given them Tamiflu just in case. Donna?
All right, Mike Couteur in Ottawa, thanks. We'll continue to follow that story in the days ahead.